microscopic level, they exist to kill. They travel, they attack, they hide, they even gather together in defense maneuvers. Pathogens are the enemies of every member of the healthcare team. On Pathogens and PPE, we give you the tools you need to fight these threats and win. So sit back, tune in, and let's make these microbes tremble at the sound of your name.
Hey everybody, this is Jill Holdsworth. I'm back in the studio today for episode 7 of Pathogens and PPE podcast. This one is all about microbiology and sterile processing. I'm here with my friend Ben Galvan, and I'm going to ask him to just give a quick intro about himself.
Hey Jill, happy to be here. I am the Director of Infection Prevention for HCA Florida South and West Tampa hospitals, and I have a background in microbiology. So I'm happy to be here.
Awesome. I'm super excited to have Ben in the studio and our two special guests. I have Tim Bowers and Alex Sundermann here with us today. A huge amount of knowledge in microbiology on the episode today. So I'm really excited to get started on this, and we will be back in just a second. Don't go anywhere. Hey, everybody, and welcome to the Pathogens and PPE podcast. This is episode 7, all about microbiology. I'm here with my co-host, Ben, and we have two very special guests with us today. I'm going to ask them to go ahead and introduce themselves. Alex, why don't you go first?
Thanks, Jill. My name's Alex Sundermann. Currently, I'm an assistant professor of medicine at the University of Pittsburgh, where I do a lot of research on whole genome sequencing for infection prevention into outbreaks and transmission. But I previously worked as an infection preventionist for 7 years at UPMC Presbyterian Hospital, where I got to meet a lot of great folks such as yourselves through APIC and everything else. So very happy to be here. Thanks, Jill.
Awesome. We're happy to have you. And now, Tim.
Hi, Jill. It's Tim Bowers. I'm the Vice President for Clinical Effectiveness at Christiana Care, a hospital system in Delaware. My responsibilities right now include infection prevention, but I was an infection preventionist for longer than I care to list. And before that, I was a microbiologist at Thomas Jefferson University Hospital. I love the field of infection prevention, and microbes are a bit of a passion of mine. So thanks so much for having me.
Great. Thanks so much for being here, guys. And I think this is going to be a really cool episode, mainly because our folks in sterile processing really struggle when they're studying for the certification exam when they get to the microbiology chapter. And that's no surprise, because it may come easier to us when we're talking about microbiology, microbes, organisms, and how they are transmitted. But when you start off in sterile processing, that may not be your just normal cup of tea or what you grow up learning. So I think this is going to be a really cool kind of intro to how those two things intersect and what might be the most important thing. And I'm really excited to have all three of you on here. You all three came very highly recommended for this episode. I don't know if I told you guys that before we started. So great to have all of you on here, including my co-host Ben, who also was recommended to me to have on this specific episode to really show everybody how microbiology fits right into sterile processing and really shows that collaboration with infection prevention and why it's so important. So I just want to start off with kind of an easy question, and I'll start off with Alex just because you're showing up right on the left of my screen. But when you think about microbiology and sterile processing, what comes to your mind? What's your first thought, and just anything that comes to your mind?
Just maybe the issues that could fall through of what is positive that should not be positive, I think, typically was whatever I think of in my field. So prior to this too, I had an undergraduate degree in microbiology, but I had no sterile processing experience. I had no hospital experience. So getting exposed to it in the hospital, pun and not intended, was a lot of interesting things to learn. Yeah. So I think whenever in my field, it's like, what are we trying to sterilize, and at what level is acceptable to us? And if anything does grow or does not look right, what is the risk of that, of transmitting further? And I think that's usually what I think of first when I think of sterile processing.
Yeah, I think you make some great points. I mean, talking about microbiology in general is a hard subject. So when we're looking at sterile processing, there's so many points where we can introduce bacteria, where we can get rid of bacteria. And there's a reason why it's so complicated, because it's not as simple as just wiping off an instrument and using it on the next patient.
How about you, Tim? What comes to your mind when you think about microbiology and sterile processing?
Yeah, I think you really hit the nail on the head when you said it's a difficult subject. Even as a clinical lab scientist coming through, it takes me a while to study for micro. And so if you're studying for your exam and it's taking you a while, that's okay. That can be completely normal. And I work closely with microbes. It can definitely be tough. In terms of SPD specific or sterile processing specific, a lot of good points already said. I'll tackle the notion of a biofilm in that, it's hard enough to kill the things that are on the equipment before you send them back out. But sometimes the prep before it even gets to you doesn't set you up for a success. And so it is a lot of moving parts to try and be successful with a surgery. This is one of them and a main one. And it can be really tough for SPD to do all of that right. And sometimes it's not even set up for success for you to make sure that product is perfect.
Absolutely. And as someone else who comes from clinical lab science as well and microbiology background, just understanding how many parts really play a role in the entire process, and really talking about things like biofilm when you're looking at the education of what is microbiology, how do the forms of transmission actually occur within the SPD space, and what makes it more difficult for them to do their job. And I think that ends up being a very important talking point when you're working with very different teams like OR and SPD, and making sure they all understand how it plays a role in that entire process.
And speaking about biofilm, just kind of going back to that comment, Tim, what do you think is just a basic piece of advice that you could give to anybody listening in IP and SPD about collaboration opportunities to attack biofilms? I think biofilm is kind of one of those words that when we hear it, we all think like, oh no, biofilms. But how can we start getting rid of biofilms or preventing biofilms by working together?
I realized I used an industry word, and in case there's anybody new to industry, whether IP or sterile processing, biofilm, it's kind of like this matrix, dead but not quite really, layer of bacteria that can cover non-alive surfaces, so catheters inside the body, but also surgical equipment that has not been cleaned off appropriately. So first step really for me is if you're receiving the equipment in your area and it doesn't look like it has been prepped appropriately after the procedure, that's definitely see something, say something, because the instruments may not be in the proper condition for you to be able to be effective at your sterile processing. And that's, you'll go through your normal processes, you'll follow everything you're supposed to do. But at the end of the day, that biofilm is going to be resistant. It's resistant to antibiotics. It's resistant to most cleaning. It can be resistant to wiping too. It's tough once it gets on there. And it's kind of, as Jill alluded to, dreaded. You don't want to start a biofilm because getting rid of it is very, very difficult, if not impossible.
Yeah, I think you really hit the nail on the head there. I mean, you should all be working smarter, not harder. And if we're not escalating those types of issues on the SPD side, then the OR may not even have an idea that it's even an issue on their end. And it not only makes your job harder trying to clean these instruments off, it can also permanently damage these instruments too, especially if they are rendered uncleanable and unsterilizable. So making sure that we are talking about opportunities when they come up is very important.
I love what you said, just see something, say something, because I do think that there's a lot of this that goes on that isn't escalated. And I really want to keep promoting that if you're a technician and you're working in decon and that these instrument trays, these case carts are coming in and bone dry instruments are on these carts, that you really do need to escalate them and you need to find some advocates to help you escalate them. And IP can be one of those advocates. Your leaders can be those advocates. But these kinds of things cannot go unnoticed and unreported. And you can use your incident reporting system. You can use all sorts of venues, but it can't continue, because if you don't report it, it's going to be considered allowable. And that is something that we do need to make sure stops, because then that's where all of these risks come in and the biofilms will start forming. And then these microbes are going to be harder and harder to kill. And that is truly what puts our patients at risks, because we are not saying anything. And so we need to make sure that if we're in leadership, if you're in sterile processing leadership, that you are ensuring that you empower those at the front lines to speak up. Alex, I want to go back to something that you were talking about, that sometimes there's things that are positive that shouldn't be. And in kind of going back to instrumentation that comes to decon, a lot of times those things are positive and we have no idea that they're positive. And so thinking about, when I think about microbiology and sterile processing, sometimes I think about, the things that we mess up and we maybe didn't clean correctly or we didn't do something right. But really, any of these instruments that are coming into sterile processing could be positive at any given time with something, because we have no idea where they came from, what patient they came from. So they could be positive and shouldn't be, or maybe shouldn't be at any given time. And so transmission could happen at any point in time in sterile processing, right? So just kind of talk about some of the risk points when thinking about decon, and when maybe all the steps aren't followed, or you're in a hurry and IFUs aren't followed, or you're thinking like, oh no, the surgeon needs this really quick, and why that would be such a risk.
Yeah, I mean, if you think about, there's like two outcomes you really look at is like, does it need to be sterilized, meaning nothing grows on it, or is it like more disinfected at a high level? And what's acceptable for the instrument for that IFU? And the steps to prevent that goes all the way back to what we were just talking about, of preventing those biofilms, of pre-soaking them and making sure that they dry right even afterwards. But not just for the exposures to the patient, but also the SPD personnel that are actually doing the processing. If they're not following the IFUs and the correct guidelines, they could be exposed to whatever is on top of this instrument as well. So it's complicated is usually the great answer to anything in our world. Yeah, just following those guidelines for every single step, making sure those indicators are met, making sure that the processes that we put in place are met for not only the patient's safety that we just talked about as well, but you never know when Joint Commission is going to show up too and just audit your process. And if you're not doing it the correct way every single time, like you just mentioned, they're going to figure it out. And your SPD staff is probably just going to say, it's the way that we've always done it. So correcting those as they go is the best way.
Yeah, and I think you make a great point, especially when we're talking about IFU instructions for use and making sure that we are actually doing what the manufacturer says we're supposed to do when we're reprocessing these instruments, because not only does it set ourselves up for success of making sure that we are providing our patients with sterile instrumentation for their surgery, you're also protecting yourselves and your colleagues. Those are probably the two biggest arms of what we think about in microbiology and preventing infections in SPD. We're not only providing safe patient care, we're also providing a safe environment for ourselves and our fellow SPD techs. Yeah,
that's such a great point. And I think that we forget that sometimes, that we're protecting ourselves from blood and body fluids. We're protecting ourselves from chemicals just as much as we're protecting our patients and making sure that we're following these IFUs correctly, which is really probably the hardest thing that any of us has to deal with on a daily basis, right? And hopefully that one day it will get easier, but it does just seem like it gets harder and harder. All right, I have a golden question for you guys, and all of you can answer it because you all started somewhere in your careers learning about microbiology. So let's dig deep into our vault of brains and think about when we first started. Alex, I'll start with you. What do you feel like is the best starting point when you're starting to learn about microbiology and organisms and how all of this ties in to what we do in healthcare? And if you're talking to some folks in sterile processing, where would you tell them to start?
Where the best place to learn is, if you're starting out and you're wanting to learn. Jill, like you, I came from a public health background, like a not nursing background, same thing as well, which I know you've talked about extensively, and I really support that. So whenever I joined into the hospital, any topic, I had to learn from my colleagues around me and the people that have been there as the experts for such a long time. So if you're trying to learn on SPD and microbiology, talk to your SPD leadership people, talk to the microbiology leadership people, because one, they'll guide you through the basics of what you need to know, but also they'll have the stories to tell that you'll cringe when you encounter later in your career about how to actually fix. And then I think looking to your colleagues in IP, whether it be others in your hospital that you have, or through, APIC National and other connections through local chapters, meeting them and talking to them about, what can you teach me? In my experience as an IP was the best places to learn. And those IPs were always so willing to help you out and to teach you. And same thing with SPD, because they're passionate about their job and they want to be able to guide you and direct you into the right resources.
Yeah, I think that's a great point. Shadowing your subject matter expert, just as sterile processing techs are subject matter experts in sterile processing, we should always leverage our fellow subject matter experts and things like microbiology. So go over to your clinical lab if you have time and talk to a bench tech. I can tell you, as someone who had to learn clinical micro in class and then actually do it in real life, nothing can substitute real life playing with microbes on a plate and seeing what can grow from these different sources like respiratory and blood and wounds and everything like that. And it really opens your eyes to what you can expect. And then, of course, your infection prevention partners, they're experts in understanding transmission and routes of how these microbes, whether it's bacteria, parasites, viruses, fungi, etc., how they kind of move around our environment and how you play a critical role in that.
Yeah, and to add on to that, I can remember the first time I went into a lab. I did not come from a lab background. And when I started in IP, I started, doing surveillance and whatnot. And one day I asked if I could spend the day in the clinical lab. And I watched how they did all of the susceptibility testings. I watched them plate things and I had my mind blown. I had no idea how all of that stuff was done or how much of it was manual. It was so cool to me. And I would encourage anyone in sterile processing who wants to learn more about micro, there is no reason why you can't do that too. There is no one in IP listening that can do that too. And where I work now, where I worked then, our clinical lab was a system lab. It was offsite. I had to go spend the day there off campus. But you can do that. There is no reason why you can't do that. And the understanding you get from that will be something you will remember forever. And I still remember it. And it's probably been 11 years ago. So I really encourage you to do those in-person, kind of hands-on experience type things that you will never learn from reading a book. And that is something that it can't be replaced in any other way. So whether you're SPD, IP, OR, whatever you want to learn about, figure out how you can get there by reading and experiencing. There is nothing like it. So Tim, how about you? How did you first learn? Do you remember?
I do, but to your latest comment, I would actually echo the same thing about SPD. If you've never been, go, because there's manual, there's automatic, it will give you a whole new appreciation to go there and learn. So how did I learn micro? It's similar to Ben. It was thrust upon me as part of my curriculum. I had to know it. I had an incentivization in that I needed to pass my first. I had to pass the class, then I had to pass my boards. I said it before. I found it incredibly difficult to it's just a lot of memorization. So however it is you do that, the only resources that weren't mentioned in the previous conversation, your local leader. If I'm allowed to use their names, Wendy Carbonara at my current organization, phenomenal at growing her team and allowing them to express interest in different areas. And I'd imagine she would allow them the day in micro, assuming the schedule allowed it, allowing them to go and identify the areas that they want to learn and go and learn them. So your local leader, as well as a pathologist. In my med tech rotations, there was pathologists that really did a great job of connecting all of the Latin names that you're going to have to learn and where they fall and who they're related to. And then what does that mean for the patient? Ultimately, that's kind of what we're here for. So what do all these things mean for the patient? And that was a great resource in addition to everything that's been mentioned so far.
Yeah, and I love your comment about your leadership because they might not even realize that there's interest in setting something up like that. So make sure that you bring it up in your one-on-ones with your leadership. Do you have an interest in learning more about micro and infection prevention and how those things kind of tie into SPD, especially if you're working towards a certification? It's really important that hands-on experience occurs because you're going to learn the best that way, at least in my experience.
Tim, I just talked to a taxonomist for the first time this year too about like name changes in micro. Just blew my mind about like how that actually happens in the end. Klebsiella, Enterobacter to our orogeny. Yeah. So taxonomists too, good people to talk to.
Can't say I've ever talked to one of those. You let us know how that goes, Alex.
Oh no, yeah, it's a great experience. Because every time we look at NHSN about like why did this organism change, and it makes sense in the end, but it's frustrating.
Yeah, and just to echo the comments, no matter what certification you're going for, whether it's the SPD certification, whether it's the IP certification, you're going to run across microbiology. So it's important to understand your learning style, how you're going to learn best, how you're going to retain it best. And I feel like this is one of the harder topics for most people, whether you're a nurse, whether you're IP, whether you're sterile processing. So it is important to make sure that you are doing everything you can to retain it and not just reading in that book. So this is a big one. And I hear people complain about it all the time. I don't know how to remember all these names, or do they come from the gut? Do they come from the sputum? Or are they commonly in wounds? And it's usually one of those things that people just try to memorize and then forget it. But when you work in our line of business, these are the things you actually need to know on an ongoing basis and then be able to apply them. So it's not something that you should just put on your wall and memorize, even though that may seem like the best thing to do when you're taking the exam. All right, guys. So we are coming up on the end of the episode. So I want to just kind of get some closing thoughts about how we can really work together to help each other understand micro and how it applies to SPD and IP together, and how we can work together to help each other understand and to really kind of combat all of our opportunities together. So I'll start with Tim first. Any closing thoughts for the episode?
Any closing thoughts for micro and sterile processing? So microbes are literally all around us. The job that we do in making sure that the equipment that we're producing and the product that we're producing is appropriate and clean or sterilized to the level that it's necessary to maintain a safe patient experience is vital. And so the more you understand about micro, I think the more you'll relate that your work is really vital in that outcome. And so, please learn as much as you can about micro. And I understand that might not be to the level of a taxonomist, but it is vitally important. And reach out if there's any questions. If you have any comments or concerns, there's either local leaders or chapters or associations that are here to help you and just continue your learning journey.
And just to echo that, I really like that you keep talking about local chapters. There's local HSPA chapters, there's local APIC chapters. And so look up all of those and be as involved as possible, as much as you can. And you're going to learn a lot from just the presentations and the offerings that all of those organizations and the chapter meetings have to offer. So thanks for continuing to mention that. All right, Alex, closing thoughts?
Yeah, I think like anything in a hospital, to make it work really well, you just have to have constant and open communication. When you look at infection prevention departments, and that includes anything that they do, the same thing goes with SPD and micro. Making sure that there's a good working relationship with those departments that will open and honestly admit when there might be ongoing issues, and to keep those conversations going, quarterly, monthly, anything about what needs to be done. Because like any department, there's going to be staff turnover. So anytime you have new people come in, you're going to have to re-meet them, rework with them, rebuild those relationships. So I think going forward, just making sure that those relationships are really sound and secure. And that'll really, make your department excel, whether you're working in SPD or micro, just making sure that those stay open.
Yeah, I completely agree. I think communication is so important in healthcare, especially these days when we're seeing multi-drug resistant organisms and even more antibiotic resistance. So making sure that we're all staying on top of letting each other know what's happening. We shouldn't be working in silos anymore. That's not what should be happening in healthcare. We want to make sure we're escalating those opportunities that we see, and then that provides us the opportunity to provide education, whether that's from SPD to OR, OR to SPD, or bringing in infection prevention too.
Yeah, that's great. And I think it's going to be really important too as we start seeing organisms, or if you in your department see organisms that maybe are waterborne organisms or that come from certain locations, that's where your IP department can really help you nail down what's going on, where might the problem be. And this is the part of microbiology that I think is fascinating. You can tell an IP, we have X organism, and they can say, oh no, where's the water source? Or so it's really great to work together because we can help each other figure out what's going on. How can we keep our patients safer? And let's make action plans together. No one is here to work against each other. We truly are here as partners. Thank you guys so much for being on this episode. I think this is fascinating. I think there's so much more to dig into with microbiology, including surveillance and how it ties into SSIs and so much more to talk about. But we are out of time for today. Tim, Alex, thank you so much for being our guests. Ben, thank you for being an amazing co-host. And we'll see you guys next time.
Thanks, Jill.
Thanks, Jill.
Thank you.
On today's episode, we highlighted the importance of making sure that we are speaking up when something happens and it just doesn't feel right, so that we can make sure those microbes aren't sticking on our instruments and forming those biofilms that we really all hate to see, but actually not see. So make sure that we're empowering our techs, and as leaders, we are making sure that we escalate those concerns when we do hear them.
And we also learned about making sure that we leverage our subject matter experts in the hospital to learn more about microbiology. And there's professionals all around us, clinical lab, OR, IP. All of these people can help us learn more about microbiology and how they can help prevent transmission of infection within our hospital and specifically within sterile processing. So don't forget to wash your hands.
And keep fighting dirty.
Thanks for tuning in to this exclusive podcast series on pathogens and PPE. For more information and clinical resources to help you fight dirty, make sure to follow us on social media by searching for Beyond Clean and Transmission Control.